Hello, I'm Dr. Frances Pitzilis. I'm going to talk about melasma, or stubborn pigmentation. Melasma is the general name given to stubborn pigmentation of the face when diseases causing pigmentation have been excluded and medical conditions. This is a very common, disabling and upsetting condition that mainly affects women and a minority of men. It's seen commonly after pregnancy when it's called the mask of pregnancy, and it's more common in Asian women and men. About 70% of Asian women have it and 20% of Asian men, and also darker skin types like Hispanics. What's important about melasma is that although it's disabling, people reach for different treatments and don't seem to get any relief for it. It is important to remember about this condition that if you've got it, you need to be aware of some specific important things. Now, the first is that you need to accept that this condition needs to be controlled and it may not ever be cured. So that's the first important thing. The second important thing is that you need to be realistic about what treatments can do for you. The third thing is that you need to go to someone who knows what they're doing, and if they haven't got an ultraviolet light called a Woods light or a Woods lamp, then they don't know what they're looking to treat, because the important thing about this ultraviolet lamp is that it will show us where the pigment is, whether it's in the superficial level, in which case if you've got lighter skin, intense pulsed light can treat it, or whether some of it, and often some of it is in the deeper level and we need to do more internal work to get rid of it. Now, in my clinic, we focus on internal health first because we know that internal stress, disease and inflammation actually is the root cause of a lot of this deep pigmentation, and we're talking about brown pigmentation. Often, fixing up some of the oxidation in the body by giving antioxidant herbs and supplements can be very useful. Also, helping a person who might be burnt out or who has a thyroid problem can be useful to reduce this pigment. I can think of one case where this person had had fractionated laser all over their forehead 3 times, and all I could see was white dots. But within a month of starting her internal treatment, we were able to halve her pigmentation. Now, when it comes to skincare, it's important to use a sunblock several times a day, and I emphasize that, even in the winter, because there's still ultraviolet coming through the clouds. In addition to that, there are now very good skin creams that help the reactions that create the pigmentation throughout your skin to be reduced. So these skin creams can block several steps along the way, and they're very useful. On top of that, we usually want a vitamin C serum, a vitamin A derived cream, or a retinoid, which they're often called, and they are invaluable in the treatment of pigmentation that is stubborn. Now, after that, some people use skin needling in the form of rollering or vertical puncturing of the skin, and I prefer the latter because it's less traumatic. Sometimes chemical peels. Now, when it comes to light therapy, although a lot of clinics have intense pulsed light, this treatment is often unsuitable for the darker skin types because it's more likely to give overpigmentation afterwards or burn that person's skin. So you really need to be careful about considering intense pulsed light. This is often why clinics will offer you fractionated laser, but this is painful and costly and you have to go back and back and back. But we have, and a lot of clinics have, this other treatment, which is a 1064 nanometer non-burning laser, a gentle laser, and we call it laser genesis. So we have this laser that in combination or on its own can reduce the pigment quite a lot when it's deep. And this is because this laser is attracted to the deep redness in your skin, which is often involved with the brown pigmentation. So, in summary, we really want to take an inside approach. We want to be realistic and accept that we need to maintain the treatment. And there are a lot of nice, gentle, painless treatments available, and you don't have to go to drastic lengths to get control over your stubborn pigmentation.